Most people don't know that between 12,000 and 15,000 people right now in Shelby County are going without any mental health care. They do not seek services, don't know where to go. And this is 15,000, 12 to 15,000 or more people on the street.
Right.
Okay? That is a huge problem. And the African American community, you know, as a whole, does not understand how emotional and mental health affects how we live every day.
We're hoping to really challenge the participants to think about the issues that confront African American boys and men, what I call really a response to a crisis. We feel that African American boys particularly are under a significant stress that leads to mental illness in our community, and so we're going to talk about some of those factors that create that crisis and to challenge the participants to think about what we can do about some of the factors that have created what I call this crisis.
Mm-hmm. What are some of the factors?
Well, if you look at some of our statistics, we're more likely, African American boys and men are more likely to be represented in the juvenile justice and criminal justice systems. When we look at what's happening in many of our families, about 38% of African American boys will spend at least 60 months with a single parent. We have good data that suggests that single parenting is a risk factor to things like greater instances of substance misuse, delinquency, and other factors because of the loss of the ability of two parents to sort of supervise children and those sorts of stressors that single parents find themselves under. Some of the other issues that we'll talk about is the overrepresentation of African American boys in special education programs, mostly for behavior problems versus true learning disabilities, for example. African American boys are 2 times as likely as their white counterparts to be suspended or expelled from school. So we want to address that issue as well. Another major issue that we've seen over the last 20 years is a significant increase in African American boys committing suicide. Historically, we would have thought that African Americans as a population have historically not been one of the major groups that have been affected by suicide. But with this 146% increase, African American boys between the ages of 15 and 19 has really seen that kind of increase. We need to address these issues. That's the crisis that I'm talking about.
What's up, America? Y'all know who this is. Dropping it. The minds of black people here in America have been affected, and it can be traced back to slavery. Those of you who have studied slavery are familiar with the psychological methods that were imposed on slaves. I have spoken detailed about Willie Lynch and his infamous document on the making of a slave. I have also spoken on how this document authenticity has been debated. Regardless if it's authentic or not, the techniques using it were implemented by numerous slave owners, and we can actually see the effects. Before I continue, let's break down some psychological disorders, and later I will detail how black people are affected by each. Bipolar is a manic depressive disorder defined by the presence of one or more episodes of abnormally elevated energy levels, cognition, and mood with or without one or more depressive episodes. Acute stress disorder is a psychological condition arising in response to a terrifying or traumatic event, not to be confused with shock. Depression is a mental disorder characterized by an all-encompassing low mood, accompanied by low self-esteem and by the loss of interest or pleasure in normally enjoyable activities. Schizophrenia is a mental disorder characterized by a breakdown of the thought process and by poor emotional responsiveness. Although we are affected by many more mental disorders, I will only deal with these few. Acute stress disorders has been prevalent in our people since slavery. Our ancestors were taken away from their homeland, stripped of their culture, and subjugated. The level of trauma was devastating, considering how would you feel if one day you were taken away from your home, never to be returned again, taken off to a faraway foreign land where the culture is dramatically different, and forced into labor. This led to depression in some slaves. Some of our ancestors were once kings, queens, princes, and princesses, and eventually became nothing more than day laborers. These people were royalty who had great wealth in Africa. Imagine how they must have felt coming to America or the Caribbean, having to wear clothes that even their servants wouldn't have worn, adapting to an unfamiliar diet, and working for someone else. That must have had an effect on their mood and self-esteem. This eventually led to schizophrenia. Most people don't consider how changing your diet can alter your mind and lead to a chemical imbalance. When you're grown accustomed to seeing your fellow slaves treated in such an inhumane fashion, this could lead to very bad emotional responses. Bipolar set in when you don't know how you may be treated on a day-to-day basis, or if eventually you will be sold to another slave owner and taken away from your family. I know some of you may not understand that many of these disorders have been genetically transferred through our generations. Many black people find having a mental disorder as a weakness. Therefore, they fail to acknowledge it even in themselves. Many black men and women have been in prison because of an undiagnosed mental condition. They really should have been in counseling, getting treatment, instead of being incarcerated. The way some black people hate themselves, it must be attributed to some kind of psychological disorder. I know some would say that people of other ethnicities suffer from the same, and I can't deny that. However, in most of those cases, they identify and deal with the problem much better than we do in our communities. Also, they have the resources available. A person who may have an undiagnosed mental disorder can pose as a serious threat to the general public and even themselves. Many states like Louisiana have made drastic cuts to mental health facilities. Under Louisiana Governor Bobby Jindal, there has been more than a 60% cut in mental health facilities. This has caused an unprecedented amount of fatal interactions between law enforcement and mental patients. Before Hurricane Katrina, the mental health facility in New Orleans had 500 available beds. Afterwards, they were reduced to only about 23. This is a dramatic reduction. Mental illness is more prevalent than diabetes and heart disease. Homeless people make up a large number of mentally ill patients. The lack of treating chronic mental illness has led to an overwhelming increase in the homeless. Many people have turned to illegal substances in an effort to treat their mental disorders. This has led to an increase in substance abuse. If you or your loved one needs help with a mental disorder, don't be afraid or ashamed to get the treatment needed. The black community must immediately start dealing with the severity of mental illness, because a mind is a terrible thing to waste. And on that note, I teach and I don't preach. Peace.